Hi, this is Dr. Brian Castelein with Brighton Foot and Ankle, and on a cold Michigan winter day, we're going to get questions about blood flow. People are wondering, why are their feet cold? Why are their feet discolored? Why do they seem to get more burning and tingling and numbness this time of year? And there's a ton of factors that go into this, but everything kind of revolves around two simple principles. Are they having their large blood vessels blocked, or are their much smaller blood vessels blocked? Now, large blood vessels, when they get blocked, a lot of times the whole leg is going to be cold, or you're going to get cramping when you're walking. Like you can only walk down the driveway so far to get the mailbox, and every time you hit that spot or that one crack in the driveway, your calf muscles are going to start to cramp. These things tend to happen in people who have poor blood circulation, poor cardiac history. Maybe you see a cardiologist, maybe stents have been placed. Commonly too, diabetics are going to be affected by this too. And of course, as we age, our circulation also ages, and sometimes those blood vessels don't do the best job. So there's a couple different tests and things that we do to make sure that the big blood vessels are open. Check out our video on ABIs and talking about diabetic exams too for those types of people. The other thing that can happen too is just at a very small level within the toes and within the feet, and these are the very small blood vessels. Things like Raynaud's disease, chill veins, Raynaud's phenomenon, these are all going to be local events that are happening at the toes, at the ends of the feet. Again, check out our videos on those things as we can go into much greater detail. But you shouldn't have to deal with cold feet, cold toes. We don't want to have things like blood flow being sacrificed to the skin, to the nerves. That's a common reason too for things like neuropathy. So it's important to go out there, get checked, make sure that you have adequate blood flow, and do the things that you can do to help increase that blood flow. Things like walking, exercise, watching your diet, and again, making sure that those systemic complications aren't causing problems with your blood flow. So come check out us, check out your local provider if you have some of these symptoms.